So the exercises that we came up with to help me move forward and get better were unique. And now you have to understand, I can't still really see, and my balance was terrible. So any movement I had, body would be like, whoa, the world's turning. Um, so we had to actually challenge those things. So one of the things we did was we threw a ball, just simply just threw a ball back and forth, a big ball, and I was standing there trying to hold myself up with this ball. Now, that wasn't easy. I needed some support to begin with, like a wall or a chair, and then eventually I moved away from that so that I was able to stand and throw a ball. And then we added moving from side to side. So I moved from side to side with the ball, throwing back and forth. Um, and of course, that was a challenge. And we did it in a room where there was padding, so if I fell, I wouldn't really hurt myself, and I fell. But that's okay because eventually I didn't fall. Um, the other thing was going up and down stairs. I would go up a stair, up a step, and lean over and pick something up. Anything that involved motion or whatever was really challenging for me, and made my life rather difficult. But the only way I could actually improve those things was to challenge it, but safely. Now, this went on for about a month, and then I was up for review whether I could continue or not. Now, with insurance, um, if you're alive at the end and you don't have all your faculties back, but you're alive, well, then that's it. If you're not going to get any better, or they think you're not going to get any better, well, too bad. You're cut off. Well, luckily, my physical therapist was able to convince the insurance company to keep me on for another month. Then I started pool therapy, where I was able to get into a pool and move about, and I didn't need a cane in the pool. I was able to walk. I mean, I had a life vest on in case I fell or whatever, and I would float. I wouldn't drown. So any kind of motion at all, any kind of challenging my balance, challenging um, my legs and my arms, challenging the turning of my head, whatever, all were difficult to do and scary to do, but necessary to do in order for me to improve. Just like life. Life is difficult. Sometimes it's difficult to get out of bed in the morning because you don't want to face the day. But the only way you're going to progress and move on and get on with life and make life better is actually to do things. To do things you may not feel comfortable doing. And that's something that I learned with my stroke. I learned that, you know, the only way that your life is going to get any better, or the only way you're going to get better, is actually to do something about your situation, even though it may feel uncomfortable, even though you may actually fail. Failure in and of itself is not necessarily a bad thing, because failure actually exercises the parts that are weak, and they eventually get strong. And that's one of the things I discovered those 2 months of outpatient rehab, is that I had to keep doing things. Even though they were difficult, even though I failed, I had to keep doing it. And it took time. Um, just recently, I had a dinner with someone who had a stroke, and he was 2 years post-stroke, and he's actually a patient of mine, and I've been working out with him. And he wanted to have dinner with me and my wife and his wife, and we had a discussion. And now the thing about stroke is when you're recovering, you never really remember the past that well. I mean, I'm trying to remember as much as I can, but you always need someone else to sort of fill in the gaps, so to speak. Now, this individual I've been working with for about a year, and he's actually driving a car now. One of the things my wife had mentioned is she didn't. I never talked to my wife about people that I treat, and she was just talking to him, and he told her, "Oh, it's 2 years post-stroke." And she says, "Oh my God, 2 years post-stroke, and you actually look great." My husband, Greg, was a mess at 2 years. I wasn't driving at 2 years. It took me 3 years to get back to work of any kind, and a further 7 years total to get back to being a chiropractor again. And then a few more years after that to learn enough to know that I can actually help people like myself. Another 3 years. So almost 10 years to get back to this point where I am right now. And this is actually 12 years post-stroke. coming up to 13 in April. So doing things doing these things, trying to get your life back again can take a long time, like anything else, but it's perseverance, it's patience, and it's understanding that failure is okay, and keep trying, and you'll be surprised what happens.